let's talk about health because we've got into that segment, and the month of October is dedicated to breast cancer, or the awareness, everything that you need to know about it. Today is just going to be the foundation. In the days to follow, we'll bring you life experience of people who are going through this disease, and then we're speaking to experts as well. But let's set the ball rolling. And Dr. Josephine Awortwe-Quaicoe is my guest. Doctor, you're welcome.
Thank you.
Before we were talking about galamsey, I don't know whether the topic we're about to discuss has any relationship.
Well, when it comes to cancer in general, you know, a lot of chemicals and radiation and things, when the body is exposed to it, can cause you to get cancer in other parts of your body and disease in other parts of your body. Yes, because most cancers don't have direct causes, but risk factors, and sometimes certain chemicals and radiations can cause the body to mutate from its original state, and then can lead to the formation of cancer in not just possibly the other parts of your body, because cancer can happen in any part of
the body.
Any part of the body.
And okay, let's talk about breast cancer. We are in the month of October, and for the whole of this month, we will dedicate to talk about this very important matter. This is a woman's issue, right?
Not just a woman. It can affect men as well.
But the percentage is quite negligible.
Oh, yes, very. It's like 1 in 1,000 for men as compared to 1 in 8 for women.
So every woman is at risk of developing breast cancer. Why so?
Yeah, because we have much more breast tissues. So when we talk about, because cancer of the breast means that like the cancer has happened in your breast. So then the fact that you are a woman puts you at risk more than men who have scanty breast tissue. So that's just the dynamic. Prostate cancer happens only in men because women don't have prostate. But then we have more breast tissue, so we are at risk of getting it.
So in terms of, we'll come to look at what causes it, but in terms of, say, taking 10 women, you will see how many are at risk of developing breast cancer in their lifetime.
It's actually 1 in every 8.
1 in every 8. Okay.
So it's not even up to 10.
It's not even up to 10. That may come up as good news.
It's not.
But it doesn't negate the fact that every woman is at risk.
It's not, because that means that for every 8 women you meet, 1 will get breast cancer. So imagine you enter into a room of about, let's say, 80 people. That means that 10 of them are going to get breast cancer. So it's not funny, and we don't know who it's going to be. So we are all at risk.
So why are there possible causes that one must look out for?
Okay, so we don't have direct causes, but we have risk factors.
Okay.
So when we say risk factors, it increases your chances of getting it. So the fact that you have it doesn't necessarily mean you are going to have it, but it increases your chance. And the fact that you don't have it doesn't mean you can't get it at all. They are not direct, but then it puts you at risk of getting it.
So everybody should look out. Every woman should look out.
Every man should, because men too can get it. And you should also know about it because you have daughters, you have wives, you have mothers, and all that. So everybody should look out for it.
So in terms of conscientizing people, and if a woman is listening, what must that person do?
Okay.
To stay safe, for example. And we'll talk about when you have it, what then must you do?
So globally, the attention is on breast awareness. Okay, it's about knowing your breast so well that the slightest change in your breast, you should be able to notice it.
What kind of change? What kind of change must get you to be worried?
Okay. Now, before I continue, I must say that by the time you visually see something happening to your breast, it's already late. That means I started spreading. Okay, that is why the screening is more important. Okay, because by the time you as an individual, you start seeing these changes I'm going to talk about, that means it's late. Okay. Because the early stages, you might not even feel anything. We call it asymptomatic. You might not notice anything, you might not even feel anything. And most of the time, like 90% of the time, there's no pain or discomfort. So you might not even feel anything. Okay, but then if you at least know your breast, if there's a slight change, at least you get it earlier than looking for skin changes or something. If you get at a stage where there is a small lump, it's way better than waiting for it to appear on the skin of your breast or affecting the change and the shape of your breast.
So by the time you see skin changes, then it's developed to a point.
It's bad. Yes.
But So you should be checking out for lumps in the breast. Is that what you're saying?
That is why for the past few years we've been advocating for self-breast examination, and then we've set the month of October for people to go to the health facility, hospital, so that they can be clinically tested. A doctor or somebody who is trained because they can look out for it better than you will do it in the house. And then other facilities are even giving discounts for mammograms, because we advocate that from the age of 40, you should be having regular mammogram, because they will detect it earlier than the doctor or you yourself will see it.
So before you hit 40, it shouldn't be a worry to you?
So according to the American Cancer Society, the guidelines they brought, between the age of 20 and 30, you can visit the hospital for the doctor to check maybe every 2 to 3 years. Okay, because the chances are lower in that age group. But when you hit 40, that is when they start recommending annual mammography. Like you should take the mammograms every year. Yes, it starts from the age of 40 to 45. Okay, so doing the self-breast exam, irrespective of your age, and then you go to your doctor 2 to 3 years if you are within that age gap. But then when you hit 40, you should be doing the mammogram.
It is just like they say to many, when we are 35 and above, you should be undertaking regular checks.
Yes.
For prostate.
Yes.
Right. So for the lady who is listening and probably is yet to experience any of these things that we talk about, your recommendation is that that person should make it a point, so long as you are nearing 40, that you have regular check.
So before you hit 40, you'll be doing your self-breast examination every 2 or so years. Go to the hospital for the doctor to examine you. But if you have a family history, then you should do it more often, because your chances increase. But then when you hit 40, every year, at least you can use the month of October to do some mammogram.
But you are from the hospital. Is this something that our ladies do often? Is this something that is very important to them?
It is important for it to be done, but I don't know whether just maybe the awareness is not out there enough. Although we are always doing Pink October, I don't know whether people grasp it enough, because we don't do the mammogram the way we are supposed to, okay? But I know that at least when it gets to October, we create an avenue for lots of people to come to the facilities to get some breast examination done for them, because the others involve money. You see, and we know in our part of the world, sometimes we don't have proper insurance and other things, because it involves money. It's a bit challenging.
And so for that person who knows her state, has been diagnosed, is it a death sentence?
Not necessarily, no. It depends on the level at which it was caught. That is why we are advocating for the screening, because the screening is such that it can catch it at a very early stage, whereby you can have full treatment and go into remission. However, if you don't you don't catch it too early, then it might be advanced. Like I was saying, by the time you see skin changes, it's already too late. So you'll be going through extensive treatments, and probably your life expectancy might be reduced.
And I've come across ladies who have had a breast cut off as a result. It means that if it wasn't cut off, it would have spread to the other side. Is that what it means?
Yes.
So at what stage do you get to that point where the doctors will just conclude that this breast must be taken off?
So when it comes to diagnosing the breast cancer, we have to determine the stage and then the grade of the cancer. So it involves the size of the tumor, how big it is, okay, whether it has spread to the lymph nodes, whether it has spread to other parts of the body, and then how aggressive, because some of them are less aggressive than others. So the doctors would have to put all these things together. So how one person will be managed, how Madam A will be managed, is different from how Madam B will be managed, because they are different. We have ductal carcinoma, we have the lobular, we have carcinoma in situ, we have the invasive, we have those ones that have already spread. Some they've just spread around, some of them have spread to other parts of the body. So they have to stage it and then determine what will be good for you. So somebody, if you catch it so early, sometimes because something lumpectomy is just a lump that can be removed
from the breast.
Healed.
And you are okay.
Yes, but for some you have to remove the whole breast and even do some axillary clearance. For some you do that and do chemo. For some you have to do radiotherapy and then put on. So depending on
that I'm assuming is a very expensive venture.
It is, especially in our parts of the world where we don't have proper insurance. So most people cannot even afford, and we don't have enough. Somebody may be put on radiation and they go to the unit, and the way they are booked. And then they tell you come back in some months' time. It's not their fault. We don't have enough facilities to handle those things. And people too don't have money. It's expensive. So we sort of have lots of challenges when it comes to dealing with these
But doctor, when you hear traditional medicine practitioners profess to have cure for breast cancer, will you say that people should patronize such, or should go through thorough testing and diagnosis to arrive at the decision that could best serve the interest of the individual?
Yes, because I think you have to go through the right channels. Okay, like I said, no two cases are the same. And when we say something is cancerous, it is very aggressive, and it can spread really, really quickly based on the grade of that.
And it can lead to your death.
Of course. The moment we say it is cancer, if it's very aggressive, if you don't handle it the right way, it will lead to your death. But if caught early and managed appropriately, you will be fine. The fact is, if you catch it early, it might be a difficult journey. But then you go through it and come out of it. If you go to the advanced countries, because they do these screenings, we have lots of people living with the breast cancer. They've had it and they've gone into remission and they are living their life 15 years post-cancer and all that. And they are living well. But over here, when we come here, we don't catch it early because people don't really screen themselves and go through all these channels. And then when it happens, some of them will resort to these herbal therapy. By the time we see them, it's already, because cancer spreads, so it doesn't have time. Okay, so you have to go through the right channels and then get treated appropriately.
This is just the tip of the iceberg. In fact, this is what we'll be doing the whole of this month on our health segment here on the Pulse. And of course, we'll be in the hospital as well to speak to people who are on admissions and people who are going through very difficult times because of breast cancer. We'll also be speaking to some specialists as well. But doctor, we'll be wrapping up. So what would be your advice to ladies who are listening to us? I mean, knowing very well that every lady is prone to this.
Okay, so I would say that now we are very big on breast awareness. Please know your breast. And then find out if you have family history, find out your other reproductive history so that you know your risk level, whether your risk is high or your risk is low. And then, like I said, be very conscious of your breast so that the slightest change in your breast, then you can go to your healthcare provider. However, if you are 40 years and above, please try and develop the habit of having a mammogram every year so that if there is cancer, it can be detected early and you can have a whole complete treatment in order to give you a better outcome.
And it's not a death sentence?
It is not.
All
if caught early. But if not, sorry.
Okay. So Dr. Josephine Awortwe-Quaicoe is from the Spenters Medical Center. She's in charge, is the head of clinical service. And of course, this is just the start. Expect more and life stories of ladies who are going through this very, cancerous disease. And of course, specialists as well. We're speaking to government officials on the plan going forward and how they are encouraging people to undertake more tests. Now, let me take you to Germany before I take you to Kumasi, because the Habitat Fair is happening in the Ashanti Regional Capital, Kumasi. The former Dutch Prime Minister, Mark Rutte, takes over as NATO boss this week, charged with holding the Western military alliance together with the war in Ukraine as a critical moment and the pivotal U.S. presidential election approaching. Join us with more details from Berlin is DW correspondent Thomas Sparrow. Sparrow, you're welcome. Now tell me, how big of a change will Rutte's leadership mean to NATO?